In today's Eye on Health, coping with COVID-19. Sure, you may have escaped catching the coronavirus, so you're physically okay, but how is it impacting your mental health?
Yeah, health experts say the impact of the pandemic is adding to the existing behavioral health crisis in our country. All the isolation and the worry, it's causing struggles with depression, anxiety, and even substance abuse.
Demetrios Marousis is Director of Behavioral Health at Highmark. Thanks so much for joining us. We're so happy to talk to you about this because I think it's so very important. So what kind of changes are you seeing since the quarantine started in mid-March?
Well, we're seeing the significant changes in terms of what providers have had to do to make themselves available. We're hearing from our providers that up to 97% of the services they're offering are on a telemedicine model. So they've had to move away from face-to-face contact, accomplish the safety that sort of physical distancing provides, and provide their services in this manner, this telemedicine model of care.
Tell us about some of the patients that you all are seeing, because what they're dealing with right now, tell us what are sort of the triggers for them. I mean, if you watch too much news nowadays, if even going out and seeing other people in masks, it sort of raises the anxiety level for all of us.
It absolutely raises anxiety, and there's a lot to be said about having a daily routine. And that daily routine, those daily rituals, those daily things that we do were disrupted. Were disrupted suddenly. And not only were they disrupted, but there was also the unknown nature of it as information was sort of being disseminated now. And then that was also blended with incomplete or incorrect information. And if you're sort of marinating in this sort of information overload, that can provoke some additional uncertainty, additional stress, additional sort of provocation of sort of your underlying symptoms.
I have to tell you, we've talked here on the show about precautions that our station is doing, and they have been really great about making sure we are ahead of everything, including adding barriers at the desks. But even me seeing those one day, it gave me such anxiety. I had to leave work early. I think what's happening is our norms are being challenged, right?
That's correct. So, how we operate, how we interact, and then how everyone around us is interacting. Not everybody is sort of agreeing with the precautions that that science is specifying. And if you need to go to the store, there's the provocation of those around you and what they're doing. Are they working hard as part of a community to keep a community safe? Are they finding it agreeable? Or are they manifesting their stress and anxiety? And you have this sort of blend, your stress with someone else's. And some people, their stress comes out as behaviors, comes out as outbursts, comes out as confrontation. And others internalize it. They're quiet about it. And they're just quietly anxious. They withdraw.
I suppose the positive thing is that people are talking about this now, but how do you know when you need to go get help? And I know you were talking about telemedicine, virtual visits, making it easier than ever before, but how do you know when to take that step?
I think if you're feeling out of sorts, just like you would take the step if you're not feeling well. I think it's better to get checked out. And have that conversation. I think for too long, behavioral health symptoms, because of stigma, because of this sort of tough it out. Oh, you'll get over it. I think people really should, if they're feeling out of sorts, if they're feeling stressed, if they're feeling anxious, if their behaviors are remarkably changing. They should get checked out. One of the things is talk to a professional, talk to your primary care physician, get that referral, get introduced to someone who can professionally assess what you're experiencing. It's quite common, it's quite typical, and it's not something that would go away all on its own.
Before we let you go this morning, we do want to talk about how Highmark is waiving fees for telemedicine.
Yeah, that's correct. I mean, this sort of dramatic shift, and really wanted to make it, lower the threshold, increase the utilization, and recognize that there's more that individuals are experiencing, and that we really prefer people take care of their health. People use their benefits to stay completely healthy, and this sort of waiver of the out-of-pocket expenses during this period of time around COVID as well, and the behavioral health and the telemedicine are all critical to honoring that intent.
Absolutely.
Yeah, thank you so much for joining us today and talking about this. It's such an important topic, and we really appreciate it.
And it's great.
Thank you. I appreciate the invite.
Great that more people are talking about it.
Yes.
Remember
Yes.
to keep watching our Eye on Health series here on PTL. It happens on Wednesdays, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.